Hello, Dr. Harlow. This is Keandre Dunn, and I'm just submitting the final exam presentation to you talking about the health communication objectives. It was a very interesting semester. I wish I could have learned a lot more than what I learned, but I did take away some things, and I did tie them together from previous classes that we took, such as public relations, even argument and persuasion to a certain extent, even rhetoric. This class did a really good job of tying other classes into this class and making it more understandable than what it was. 'Cause I didn't think health communication was that important. I mean, I knew it was important, but I didn't think it was anything that required a class. so, but the objectives of this class were very important because it pretty much gave the blueprint to the class and how we were going to do in the class and the assignments that we were going to take and all those things. And it pretty much just provided a good blueprint and a good structure to the class. And the first one is identifying the stakeholders in specific health care situations along with their needs and their values. And yeah, so the book pretty much defines stakeholders as anyone and everyone touched by the event. So it could be children, co-workers, employers, customers, reporters. It could be the media. It could be public officials. I mean, you name it. So, for example, let's say for example, if Obamacare wasn't working properly, the media is gonna have a frenzy over those type of things, and they're gonna cover it. The people who are going to be affected by it the most are the customers who got to pay the high premiums. So yeah, the stakeholders can be anybody just touched by it. Even if you talk about it at one time, you could be a stakeholder. You don't have to necessarily be involved with the company necessarily, because everyone thinks of a stakeholder as someone that actually invested into the company. And that's not what it means when it comes to health communication. It's just defined by someone who's directly touched by it or indirectly touched by it. Two, compare and contrast definitions of illness, health, and healthcare in various cultural models. So I had wrote about this with my cultural comparison paper, and basically like comparing how the United States is different from Japan and China, and how they view healthcare. Because Japan, for example, didn't even upgrade their healthcare system until the 1980s. For the most part, they did a huge upgrade in the 1980s. As compared to the United States, we were always upgraded healthcare whenever needed, possible, and FDR kind of took a hold of that and kind of pushed that forward. And so I basically put in my paper, for example, according to European medical info, all cultures have systems of health beliefs to explain what causes illness, how it can be cured or treated, and who should be involved in the process. The extent to which patients perceive patient education as having cultural relevance for them can have a profound effect on their reception to information provided and their willingness to use it. So again, it's just stressing the difference between the healthcare and then the different cultures. Like for example, Germany has free healthcare. So there's countries that have total free healthcare, and they afford that with their taxes. So in comparison to what we do over here, where Obama, you could see where he was kind of going there. He was trying to make healthcare affordable to poor people. And to a certain extent, he did, but nothing's going to ever be good on the first try. So it's still a work in progress. Three, discuss ethical concerns in the practice of health communication, particularly with respect to power differences between communicators. So I took this as basically when someone is talking to the doctor and the doctor has to go back and say, hey, and what I'm doing, is that legal? And is it culturally acceptable? Being able to communicate as a doctor is very important because that's ultimately how people decide if you not necessarily if you're a good doctor, but if you're a doctor they're comfortable with. And the one thing they have to do is make people comfortable whenever it's a tough situation and stuff like that. So, uh, being an emphatic listener is also important. It exists in the patient's life because again, like you don't know whether they're dealing with something like cancer or multiple sclerosis. You don't know. You have to listen. You have to understand what that patient is going through. Otherwise, they just go to a new doctor, and they won't they won't stand for you. So Number four, explain how the context of health communication affects interpersonal interaction among stakeholders. Again, going back to what I just said, communication is key in everything. Clearing the air with all these things, telling the patient the risk, the cost, making sure the patient can afford it, making sure that you can see the patient, make sure you understand what the patient is going through, make sure you understand every single situation that is involved with the patient, because every situation is different, and it's vital to understand those things, and so you can understand and move forward. And it's better as a person too, to just understand what everyone's situation is. So number five was determine an appropriate research method to use in basic and applied health communication studies. And one of the methods I used personally was a questionnaire. I know a lot of people use focus groups, interviews, case studies, and quantitative research. I do love my statistics, but I feel like if I want to know about someone, I feel like the best thing to do is to ask some questions. And a free-flowing conversation is also good too, but I feel like a 12 to 15 questionnaire would be ideal, especially for something like my study, which I did, was the anti-heroes, how people relate to anti-heroes because of their flawed appearance, or how they identify with the character. So I feel like that was best method for me, at least. And I feel like putting something down on paper can, in some ways, can be better than actually discussing it in person. But it just depends on what group, what case study you're using, or what focus group you're using, and so forth and so on. And evaluate a health promotion campaign for its rhetorical effectiveness and ethicality. Well, I used the above the influence because I'm wearing a shirt right here. But it's something I've always identified with. Me personally, I've never smoked or something like that. So I've always identified with this particular campaign. So I've been following them since I was maybe like 12. And I know they always come at you with the quick stats on their commercials and stuff like that. The use scare tactics and on the emotional appeal to kind of affect the viewer. And it works to a certain extent. I wrote about this in my paper as well. Like it does work. It just depends on the age range and household, typical stuff. It depends on, is the parent involved enough to put the forces down a student's throat, and are these commercials affecting the student enough to get them to stop doing drugs or whatever, if that benefits them. So I use above the influence. I think it's personally one of my favorite ones. It probably is my favorite one. I love the merchandise. I loved everything from the arrow going up, like so like with the circle around it. So that was always a big thing to me. And going back down to number 7, which is apply one or more theories for communication, sociology for psychology and or related discipline to analysis of a current issue in healthcare. I used social cognitive theory, and it was pretty much because it was too difficult for me to use. Like one of my personal favorites is spiral of silence. I didn't know how to tie that into it. Maybe I could have, but I didn't use cultivation theory either. Those are my two favorites, but I didn't get to use those. So I used social cognitive theory, and pretty much this theory states that when people observe a model perform their behavior and the consequences of their behavior, they remember the sequence of events and use this information to guide subsequent behaviors. And then depending on whether people are rewarded or punished for the behavior and the outcome of the behavior, the observer may choose to replicate behavior model. The media also provides models for a vast array of people in many different environmental settings. And so that was in the book. I didn't see too many theories in the book. That was one that I wish I could have learned more about. I wish I could have wrote a paper over it if I had seen it, because it would have been really interesting to talk about something like that. And finally, it was describe how the structure and communication patterns of healthcare organizations affect care providers, patients, and other stakeholders. So this is the best example for me is when Miss Tambunga came in and talked to us about how she worked at was it Blue Cross? I forgot whatever healthcare she worked for, but she basically told us how they ran the organization, and how it was structured, and how they communicated with their patients and things like that. And but one from last year that really resonated with me was when we talked to the woman from from Red Cross, and I believe it's public relations, but it still factors in. And she told us how they communicate on social media and how they deal with the backlash on social media when they do have a crisis in their company. And so that really resonated with me because I got to ask her questions personally, and she was in my hometown of Dallas and stuff like that. So that was very important to me to learn about that because I didn't know that so much went into what Red Cross did. I knew that they did a lot of good work because of obviously I've dealt with them personally, but I didn't know that they were so organized from top to bottom. But yeah, I learned a lot in this class. I feel like I could have learned a lot more, but I'm pretty sure you'll find a way to tie this class into other classes moving forward. So I have no doubt that I'll continue learning about this class next semester and in the future. But that's it. Hope you enjoyed this video.